If you're watching this right now, there's a good chance you've swallowed 3 times in the last minute without even realizing it. That thick, stuck feeling at the back of your throat? You've been living with it, checking it, praying it's not something serious. Here's the number that will stop you cold. Doctors examine this exact symptom in millions of people every single year, and in the overwhelming majority of cases, they find absolutely nothing physically there. No lump, no blockage, nothing on the scan. And what I am about to show you changes everything. I'm Dr. Helen. In 20 years of practice, I've seen this work when everything else failed. So let's talk about what's really going on. This feeling has a name. Doctors call it Globus sensation. And here's the part that surprises people the most. It's not usually your throat that's the problem. It's the messaging system between your throat and your brain. Think of it like a smoke detector in your house. A good smoke detector is supposed to go off when there's actual smoke. But sometimes the wiring gets a little too sensitive, and now it goes off from steam in the shower. Nothing's burning, but the alarm doesn't know that. Your throat can do the exact same thing. The nerves there can become hyper-alert, picking up on normal sensations, a little dryness, a little tension, a little swallowing, and blaring an alarm that says something is wrong here, even when nothing dangerous is happening at all. Now, why does that wiring get so sensitive in the first place? 2 big reasons keep showing up again and again. The first is silent acid reflux. And I say silent because most people picture reflux as heartburn, that burning feeling in your chest. But research has found that reflux shows up in a huge share of people with this throat sensation, sometimes without any heartburn at all. Acid can travel all the way up into your throat, where the tissue has almost no protection, and irritate it just enough to create that lump-like feeling, without ever giving you the classic warning sign you were taught to look for. The second reason is tension. Not the kind you notice, but the kind that lives quietly in your throat muscles. Stress and anxiety don't just sit in your shoulders or your stomach. For a lot of people, that tension collects right at the base of the throat. It's the same muscle response that makes your throat tighten when you're holding back tears. Except for some people, that tightness doesn't go away when the moment passes. It stays. And here's the part that keeps people stuck for years. Once that alarm goes off and you start noticing it, checking it, worrying about it, the worrying itself keeps the alarm switched on. Your brain starts scanning for the sensation constantly, and the more you scan, the more you feel it. That's why so many people say it gets worse the moment they try to relax, or right before bed when there's nothing left to distract them. So here's what we actually do about it. Not guesswork, a real approach in order. Step 1. We calm the reflux if reflux is part of the picture. That means paying attention to what happens in the 2 to 3 hours before you lie down. Eating your last meal earlier, not right before bed. Avoiding the big triggers, especially caffeine late in the day, alcohol, and very fatty or fried food in the evening. Sleeping with your upper body slightly raised, not flat, so acid has to work against gravity to reach your throat. These sound small. They're not. Clinical care for reflux consistently shows meaningful improvement in throat symptoms within just a few weeks of these changes, especially when they're combined with medication guidance from your own doctor when it's needed. Step 2. We retrain the alarm. This is the part almost nobody tells you about. Gentle throat relaxation exercises, slow, deliberate swallowing, humming softly, rolling your shoulders and neck to release tension can lower that hypersensitivity over time. Speech therapists who specialize in this call it laryngeal relaxation work, and it's one of the most underused tools out there because most people have never even heard it's an option. Step 3, and this is the one that silently kills progress for so many people. Stop checking. Stop swallowing every few minutes to test if it's still there. Stop Googling it at 11 at night. Every time you check, you're pouring gasoline on that oversensitive alarm system. The people who recover fastest are the ones who learn to notice the sensation, acknowledge it, and then deliberately let their attention move somewhere else. That single shift, more than any remedy, is often what breaks the cycle. And step 4, get it checked once, properly, by a doctor. Especially if you notice trouble swallowing food, unexplained weight loss, pain, or a lump that you can actually feel with your hand. Those are the signs that need a real medical evaluation. But once serious causes are ruled out, that reassurance itself is part of the treatment, truly. Studies on this condition show that simply understanding what's happening and knowing it isn't dangerous measurably reduces how often people feel it. Your body has been waiting for this signal for a long time. Now you know how to give it. If this explains something you've been feeling and couldn't put into words, drop your city in the comments below. I want to know how many of you have been carrying this quietly. And if there's someone in your life who's been dealing with this exact feeling, send them this video today. It might be the thing that finally makes sense to them. This video is for educational purposes only and does not replace the advice of your personal physician. Always consult your doctor before making changes to your diet or lifestyle.